Good afternoon, ladies, gentlemen. Buenas tardes. Bonsoir. Bienvenue. So we are now 4:45. We had a fantastic day, a huge marathon of sessions with a lot of information. And now we are here at another very, very important session on clean air for a healthy future, protecting children from air pollution. And this is a session that is co-organized between the World Health Organization and UNICEF. Thank you very much for this joint work. I'm still Gerry Eikemans, the director of the Department of Social and Environmental Determinants for Health Equity from the Pan American Health Organization. And it's an absolute honor to be here as your master of ceremony. We have a lot of speakers in this session. So I'm going to ask, ahead of time, I'm going to ask my excuses for having to, cut on time so that everybody will have a chance to go to the cocktail on time and any other things you would like to do. So we've heard earlier today in the testimonies and in other parts of the meeting of the impact of anyone that's affected by climate change and by air pollution, or even worse, dying from the exposure to breathing polluted air is terrible. But for a child to suffer or to die from this is totally unacceptable. So this should be the argument, and this is the session that is going to make the argument for why we need to act now. In this session, we will showcase how to protect children's health from air pollution with examples of intersectoral action, health sector strengthening, and advocacy. I will keep it very short, and I'm going to ask our keynote speaker, Dr. Maria Neira from the World Health Organization. Please, Maria, join us here and give us your insights. Thank you, Maria.
Thank you, Gerry. Thank you very much, Gerry. Good afternoon, everyone. And Gerry asked us to be very brief and to the point and not losing time, so here I am. Thank you very much. A critical discussion today. And I think we all have a huge responsibility on responding. Let me start with something a little bit provocative. You will see in this graphic two key messages. One of them is that the global children mortality is going down. Good news. But we reach a level where we need to keep fighting with those, trying to go even below that mortality level. And then when we look at the causes of this mortality, you see that the first one is prematurity, and the second one are lower respiratory infections. So my question to all of you is, this one is air pollution, maybe the one that we need to address, to tackle, to fight, and then we will be able to finally see a decrease on this mortality caused by lower respiratory diseases. I think it's provocative. I think it's probably the reality, and I think in all the agendas on children's health, we need to start to incorporate air pollution in a more definitely very proactive way and trying to reduce that mortality and demonstrate that we are reducing that mortality because we are addressing air pollution as the reason for this mortality. Next one, please. Okay. This is the message here is very clear as well. 2.7 billion children under 15 years are exposed to very unsafe levels of air pollution. And of course, as you can see in yellow, this is the place where children are even more exposed. No surprise, vulnerable populations, Africa and some parts of East Asia, where the concentration of children exposed to those high levels of pollution exceeding the WHO air quality guidelines are there. We are talking about population exposed to 2.5 p.m. Next one, please. So one way to reduce exposure, or the best way to reduce exposure, will be simply endorsing the standards, the air quality standards of the air quality guidelines of WHO, and this will be what we can say for children's health a best buy. As you can see at the moment, when you look at the different regions around the world and how they are endorsing those standards, we are far from being at the top of our quality of endorsement of those standards. You have the European continent where is a little bit better, but still we have plenty of room for improvement. And the rest of the continents, with Africa having the poorest, the lowest level of endorsement of those air quality standards. And my last one, or almost the last one, is this, summarizing what it will be a priority agenda, the actions that we need for the health sector to put in place. Obviously, we need to do much, much more on strengthening advocacy and policy development, and obviously in collaboration with other partners, and then we have an important one here with us, UNICEF. We need to support the healthcare facilities and service delivery. Don't forget that this is an important part and where we can do more advocacy, and we can monitor as well and build robust data collection and monitoring. That will be very useful to influence a little bit more the political decisions, the policy decisions. We need to strengthen the public awareness and education, which is part of what we are doing today, and mobilizing pediatricians, mobilizing all the health community and beyond. And of course, looking for this cross-sectoral collaboration that is a must in all the topics we are discussing here today. I'm done, Harry. Is that okay? Just one thing to keep attention is that, please, this is an introduction to children's environmental health. You can upload and discharge this app, and you will have very relevant information. So thank you very much. Thank you.
Around the world, environmental pollution and climate change are having a growing impact on children's health and children's lives. I'm Kathy Russell, UNICEF Executive Director.
I'm Tedros, the Director General of the World Health Organization. More than a quarter of death and disease in children under 5 years of age is attributable to unhealthy environments.
We all have a responsibility to create a healthier planet for children. The health sector has an especially crucial role to play, and that starts by making children's environmental health a priority.
WHO and the UNICEF have come together to create this free online course for health workers outlining what they can do to protect children's health from pollution and climate change.
This course provides an overview of the field of children's environmental health, focusing on toxic metals and chemicals, air pollution, climate change, and other hazards to children's health.
It will equip you with the knowledge you need to protect more children.
UNICEF and WHO believe that every child has the right to grow up in a healthy environment.
The health sector.
No, please, sorry.
Around the world, environmental pollution and climate change are having a growing impact on children's health and children's lives. I'm Kathy Russell, UNICEF Executive Director.
I'm Tedros, the Director General of the World Health Organization. More than a quarter of death and disease in children under 5 years of age .
Sorry. We're going to try one more time. Maria, all the time you gained, we are using it now for the video. So can we try one more time to put it back up? Thank you.
Is attributable to unhealthy environments.
We all have a responsibility to create a healthier planet for children. The health sector has an especially crucial role to play, and that starts by making children's environmental health a priority.
WHO and the UNICEF have come together to create this free online course for health workers outlining what they can do to protect children's health from pollution and climate change.
This course provides an overview of the field of children's environmental health, focusing on toxic metals and chemicals, air pollution, climate change, and other hazards to children's health.
It will equip you with the knowledge you need to protect more children.
UNICEF and WHO believe that every child has the right to grow up in a healthy environment.
The health sector can help realize that right and help us to safeguard the health of every child. I thank you.
Well, so thank you. After those compelling arguments that we heard from Maria and from WHO director and from the UNICEF director, I think we're ready to dive deep into our next session. So first of all, I forgot to say there is interpretation in 4 languages. So Spanish, English, French, and Portuguese. So if you need it, please go get a headset. I'm very pleased now to go into the next session, which is about science and policy highlights. So I would like to invite our 3 speakers of this panel. We have Jonathan Guig. Please join us, Sébastien Denis, and Mofoko Fomame. Please join us at the stage. Thank you. So while we getting our panelists on the stage, I'm going to ask Jonathan Guig, who is a professor of pediatric respiratory and environmental medicine from Queen Mary University of London, and from WHO GAP task force TAG member, to make a presentation about the status of the research on air pollution and children's health, gaps and needs. Welcome. And there is a pointer here. Thank you.
Thank you very much. I'm going to give you a very brief snapshot of what we know and what I think we still need to know. So this is an infographic from a report now, about 9 years ago, that was published by the Royal College of Physicians, showing the effects from epidemiological studies on children's health. So we can see in the fetus, we have worrying effects on growth, so mother's exposure to air pollution. This is outdoor air pollution, mainly from traffic. In the infant, we see vulnerability to respiratory viruses and bacteria, leading to coughs and pneumonia, and the start of wheezing illnesses triggered by viruses. And then as we move into the school-age child, we see the development of asthma, so more cases of asthma in those children exposed to higher levels of air pollution, and the start, we think, of the conditions that are going to lead to morbidity and mortality later in the life course. So, what do we need to know? Well, this is, again, my own personal view, and some of the sessions have addressed this as well. I think it's important to know whether all particles, particulate matter, are actually equal. They certainly are not, but we really can't make a distinction between different types of particles, inhalable particles, from biomass or from even the small fraction of natural dusts which are inhalable. The emerging issues of brake and tire wear as we move into a more alternative fueled environment, as well, of course, as cooking fuel and the emerging worries about nanoplastics. This just shows one issue related to this. This was a study that we published last year where we gave over 300 children in Africa. We've seen the data from Africa from Maria, where we gave children who had asthma symptoms backpacks which monitored their personal exposure to PM2.5 as well as to nitrogen oxide and other pollutants. And what we found in sub-Saharan African children is very high levels of exposure certainly compared to children in London who had very much lower levels. And we have those, the coloured bars shows exposures in the commute to school, at school, and at home. So broadly similar, and a large number of children with exposures over 20 micrograms per meter cubed. And in some of these children, we've looked at lung function. This is unpublished, where we see actually that these exposures have resulted in reductions in lung function, acute reductions in lung function. And these exposures are not all fossil fuel. In fact, the majority are from indoor exposures, from burning of rubbish or cooking and unpaved playgrounds, major exposure. So this is really important we understand the relative toxicity of particles. Another issue is, of course, what is the independent effect of the other parts of the pollutant mix, the gases? We've heard about ozone, but what about nitrogen dioxide? This is from a paper that of a study that we did in East London using nitrogen dioxide, modeled nitrogen dioxide exposure as a marker of exposure of school-aged children to traffic-derived pollution. Now, of course, we're using, in this case, it as a marker, how much nitrogen dioxide are contributing to the effects that we saw on lung function. So we saw decrements of lung function in children exposed to higher levels in this cross-sectional study. But how much was due to nitrogen dioxide, I think we still need to know. And again, that's really important for policymakers. Another, and perhaps an important thing, the infographic showed that we have worrying associations between exposures of the mother to pollution and cognitive effects, neurocognitive effects. And the biological plausibility of that is really important. So yes, how do we understand those non-lung effects? Can we understand those mechanistically? And certainly particles do get around the body, and this is a study where we isolated macrophages, sort of the cells that take up particles from the human placenta, and we could see in those placental cells spots of carbon with the signature of fossil fuel derived particles. So these particles are going around the body, lodging in various areas at low concentrations relative to the lung. How much are these driving the health effects? And if that's the case, we're going to be seeing emerging effects in many other organs over the next, with epidemiological studies. So that's a very brief summary. There are many more areas, and I think someone commented that, well, we don't need to measure anything anymore. Well, I do think there's some areas that we do need to sort of expand and invest in research in order to firm up where we're going to direct our mitigation strategies. Thank you very much.
Thank you. Thank you so very much, Professor Grigg. A couple of very important points, I think, particularly also in the end. Yes, we know enough to act, but we still don't know enough to act better. And I think this is really important. And I think also the point on the cognitive effects, when this became clear on lead, that's, I think, when the whole lead movement and the lead out of paint movement started. So I think it's a very, very important point that we should definitely look at further. Thank you so much. So the second presentation is about shaping urban health planning for clean air and children's health. It's going to be given to us by Sébastien Denis, Directeur Santé, Environnement, Travail, Santé Publique France, or the Director of Health, Environment and Work from the Public Health Agency in France. So the floor is yours. Thank you. He's going to speak in French, so be warned.
Yes, and thank you very much for the invitation. Yes, I will permit myself to speak French as you have the translation. It will be more easy to be fluent, as we need to be brief, I think. En effet, nous en savons assez pour agir, mais néanmoins, il est force de...
In fact, we know enough to react, but we can see that we still have, as has been said, a whole lot to do in terms of advocacy so that politicians can help us in decision making to reduce this contamination. It shows us the role of the National Agency of Public Health and the importance to connect public data with science. And
Il y a beaucoup de spécialistes sur la vulnérabilité particulière des enfants. En France,
I'm sorry, I'm not receiving any relay in the language. Because these are people that are growing, developing, and have a higher presence. So some of them are immature and more sensitive to toxics. So there is a social and economic factors such as poverty. They will also show that for developed countries such as France. We need to consider that to understand that those populations are priority. It's a huge challenge for public health, and we need to motivate the countries in a priority manner. Also at a territorial level. We also need scientists. And for those that have already talked about this before me, what are we going to do? How are we going to get ready? Those are tools that have already been mentioned and that have been developed by the WHO. The WHO that has already information that are very important. We have important info that has to do with atmospheric contamination, information that needs to be used that talk about risk exposure for several scenarios of air pollution and the incidence of some pathologies such as asthma. If we were to apply guidelines values such as those from WHO, pillars that have the knowledge, the fact of checking on this is helping us for decision making. Because those are instruments with bigger impact. Those tools that have been developed by the WHO we have tools as MAPEC, this is developed by WHO that helps us to work with different tools and different levels in different countries, which was shown. It's been a relevant finding to work with these children up until they're adult. It's a very terrible, it's a situation that pushes us to address diseases such as asthma. A study that involved 200 institutions to analyze this, a situation that helps us study cases of asthma in children. What you said about those, the PR 2.5 with the particles and up until the period of 2019, cases that could be avoided. And a reduction of atmospheric concentrations in those particles and the values that have been proposed by the WHO of the dioxide nitrogen. One of the cases that should be taken are showing the recommendations of WHO. These cases couldn't be avoided in children that reach about 11,000 cases of asthma that could have been reduced if we were if we could expose them to lower values of nitrogen dioxide. If they're smaller, if we consider the cases of asthma, they are now being reduced in an equivalent manner for children. We also find that this study can help us show an argument for physicians to reduce the values. We're still working with a budget in thousands of euros to work with them and to compare. There are lower costs in the case of adults. So we can help the politicians in that decision making. This is a multisectoral approach that needs to include all these sources of emission. Hence, we need tools that can help us monitor their surveillance and characterize it, and help us in the public sector to protect children, something we need to do. I must say that we have many available sources of internet and some others by participants of the sector. And I must say that I thank all my team for helping me. Thank you for your attention.
Merci beaucoup. Thank you so much for this very inspiring presentation showing that it's really possible and to really move ahead with this most compelling public health need that we have at the moment. So thank you. So our last presentation is about a recent legal victory protecting children's health from air pollution, a case from the Highland region of South Africa. Dr. Mafoko Fomame, environmental health campaigner, Groundwork, South Africa. Maybe I called you doctor, and maybe we're so used to that, I'm sorry, but you're much more important than a doctor, so come here, please. Thank you.
Thank you very much. Good afternoon, everybody. So we're moving from the science to activism and a lot more of the policy change. So just by way of background, in South Africa, the Mpumalanga Highveld is known for rife air pollution. Air pollution has been a feature of the landscape since the 1950s. The Highveld is home to 12 coal-fired power stations, and the place is also rife with a lot of socio-economic challenges, unemployment, poor education, poor health access, and over 2,000 premature deaths have been attributable to the coal-fired power stations, children included. The Cancel Coal case is our first youth-led case. It was launched in 2021, where the youth really stood up to sort of say, enough is enough. So the challenge is to the state. The state's plan to procure 1,500 megawatts of new coal-fired power. And so the youth from the African Climate Alliance, Vogani Environmental Movement and Groundwork got together and sort of said, we need to cancel coal. And what the case did was showcase the impacts to climate, impacts to health, as well as air, water, as well as the economic harms that would come from procuring new coal-fired power. And really the case just calls to ending new coal. But also what it did is it pointed out that new coal power would be in conflict with South Africa's commitment to its climate change obligations. And so what the youth did was really get together and talk to environmental lawyers to point out the rights, their constitutional rights that would be impacted on with new coal-fired power. The right to a clean environment, the right to dignity, the rights of a child, the child needing to be involved in matters that pertain to the child, food, shelter, and a whole lot of constitutional rights would be contravened by this new coal-fired power. And what the courts found were that the state did not consult the youth in the decision to procure new coal-fired power. The state also felt that to procure new coal-fired power is unlawful and unjust and is in breach of the youth's constitutional rights. And really, the idea of the climate crisis being a child rights crisis was rife. Experts put together testimonies as well as the children themselves in sort of, making a case for the need to cancel coal. A lot of the research that's being done is normally research that's dependent on modeling. And a recent study that used actual morbidity and mortality data in South Africa indicated that those that live in coal-fired power stations are at risk of air pollution, respiratory illnesses, as opposed to those that don't live in areas that have coal-fired power. And so the annual number of deaths would be increased by 6% in communities living near coal-fired power plants. And like I said, this was the first study that used actual data. They used the various data sources, death certificates, cases of pneumonia in children under 5, and government equality information. And I think the case of children was really being made in that about 60 more babies were born with cleft lips and palate birth abnormalities in the regions near the plants. And so this is a harrowing statistic that is new and is adding to the evidence that is needed. I think this morning the UN Special Rapporteur indicated on the need for more action and not more litigation. And so as we, as the health community, advocate for clean air, we also need to take a bold stance like the youth and really demand the just transition away from fossil fuel-based energy to more renewable energy, but also embark in health planning, health surveillance systems. Early warning systems have been talked about a lot today, but really taking a bold stance as the health community. Thank you.
Thank you so very much for this inspiring story. Things are possible. So we have some time now, thanks to the discipline of our speakers, for some questions from the room, just in case we are being recorded. So I just want to mention that, forgot to say that at the beginning. So we have 10 minutes, so please keep your comments and your questions short. Sometimes the comments from the floor are longer than the presentation, so I hope that this time we can avoid that. So let me get a pen and then please formulate your question. Do we have microphones going around? I don't see any. Do we? Do we have? Thank you. So meanwhile, think about your questions and to who you want to direct. Any questions? I don't see any hands raised yet. Of course, it was all super clear, but also very, very inspiring. So I'm sure there are some people who would like to ask a follow-up question. Here, we have a wave, George, from the front. Here is a first question. Yeah. Thank you. And please introduce yourself also when you ask the question. Thank you.
Thank you so much, Jerry. I'm Josh Carliner from Healthcare Without Harm. My question is for Mafoko. I'm wondering, what do you think some of the lessons are that you've learned through the case and the victory that you had that could be applicable to folks from other countries as they do this kind of work?
Thank you, Josh. I think lessons learned are related to the need to build movements. Movements are impactful and they are able to move the needle as far as policy change and advocacy is concerned. And I mean, the youth in this case were very adamant that they're going to hear the case. And I think what's been also pivotal is partnering with experts, so health experts providing the evidence, health experts being able to stand up and speak in solidarity with impacted communities. So those are some of the lessons learned, but also what's important is looking forward in terms of health systems reform. Are our health systems ready to actually be resilient in the face of climate change? Thanks.
Thank you. We have another question here.
Quick question for you as well. Was there any backlash regarding potential increases in energy prices or something like that? Because, of course, access to cleaner energy might be more expensive. So I don't know if you experienced something like that.
There's definitely backlash, and there still is. So I did mention that the Minister of Energy actually appealed the whole case. So what happened was the minister made a determination in the new resource plan of procuring this new energy. And so the resource plan still hasn't been reformed or amended based on the case. There are also other backlash related to security issues for the youth, right? Because demanding such a bold kind of undertaking of canceling coal has economic repercussions for communities, for the whole country. And so it is a very controversial stance that's been taken. And but the youth are adamant that they're pursuing it. And so the idea would be for the minister to then amend the plan to procure new energy, but as it stands, he's appealed the whole case, and so we are hoping it will be heard at a higher level, and that will probably be in our favor.
Thank you.
Thank you to the panelists. Ricardo Pineda here from Sustenta Honduras. More of an open question. I find very valuable these specific cases, but I'm wondering if you have any awareness of perhaps any more global or perhaps more regional studies where they have been able to quantify how much more are children exposed versus the general population, or what's the exposure in terms of risk. Just as a little bit of context, we're trying to advocate essentially for more child responsive funding specifically, and I think any information that we could gather around why children specifically, instead of perhaps any other group, would be useful. And so it's just more of an open question, but thank you.
Thank you. And I think apart from what Dr. Neira has already told us in the very beginning about how the exposure and is particularly impacting children, please.
Yes, certainly personal monitoring can answer some of that question. I mean, as far as I know, a lot of the studies are focused either on adults and children and not the pairs. What we also need is a good biomarker of internal dose. And it looks like that we might be able to do that looking at particles in the blood. But yes, I mean, it's almost certainly children, we think, are going to be exposed to higher levels of pollutants, especially very young children, just because they're lower to the ground. But actually, remarkably, we don't have a lot of data on that.
Yeah, just to add, thank you for your question, because very important, as we also have derivated all the estimation I've shown for the national reference values to the regional values, to the French regional values. And so as far as you have the exposure risk relationships and the monitoring system, I would say that would allow that allows you to have the monitoring values of air quality. You can derive this estimation, and indeed, according to the activity, the industrial activity or agricultural activity or way of transportation in the different regions, the estimates will be different, and that's very important as the political, the territorial political level is very important in this matter of air pollution. It's very important to advocate to regional authorities and regional third parties. So very important, yes.
Thank you. Mafoko, you want to add something to this question? No? Any other questions? If not, I think this was a fantastic panel that has managed to show global, national, local, and particularly how science combined with activism can really have impacts. And so thank you so very much. Give them a great applause. It was very, very interesting. And so now we're going to our next panel, which will be a panel discussion. So I'm going to invite the 4 panelists to the podium. Maria Sonabel Anarna, Supervisor of the Health Program Officer, Department of Health of the Ministry of Health of the Philippines. Please join us. Americo José, Head of the National Health Observatory of the National Institute of Health in Mozambique. Also, please join us. Thank you. Then Julian Fernandez Nino, Deputy Secretary of Health of Bogota Municipality, and Rosamund Ella Kisi Debra from the Ella Roberta Foundation. Again, welcome. So I'm going to take a seat with you. I think it's more interesting. So welcome to this session. So we have 4 panelists here who come with very different experiences. Give me one sec, I lost my speech. My questions. Give me one second. Somebody wants to say something in the meanwhile? Sorry, you have a question? Give me a sec. Sorry. Wait. Thank you. Okay, so sorry for this. So I have a few general questions for each of you. So at your country or city level, what are you doing to protect children from air pollution and from environmental risks? So, and from your different place where you sit, where you stand, where you have power. So let's stay in Latin America. Let's stick with Colombia, with Bogota.
I'm gonna talk about Bogota. In the case of Bogota, one of the main challenges that we have, not just in air pollution, but also in public health in general, is how we understand and make other people understand that public health is a little bit what public sector does, but it's a lot what other sectors can do. And in order to do that, we want to elevate public health as a priority, not just of the Secretary of Health, but also a priority of the mayor himself. Because the mayor is the real head of the health determinants. So part of the challenge that we have is that this topic is clearly a concern for the health sector and the environmental sector, but it's not the same with the education sector. So we're trying to to show them, I mean, the other sectors, how they can do a lot and even more than us, because we can see the results in the hospitals, we can see the outcomes in our epidemiological surveillance, but we don't have the governance of the social determinants. So I think that just to finish, this involvement of the education sector is something that is very fundamental and requires to build a common narrative with all sectors, and also to show them that that could be also something good, not just for the health sector, but for everybody.
Thank you. Thank you very much for putting this, that you have to really work at the highest level of government in a city or at any level to make progress. Thank you. So I'm going to move now to the other side of the world, to the Philippines. So you are the, Maria, you are the supervisor for the national, for the health program, no? For the Department of Health in Philippines. But please, what's your secret?
Okay, thank you, ma'am. Good afternoon, everyone. One of the strengths of the Department of Health in combating air pollution to the general population and even to the children in protecting their health is I have one slide to show. It's okay, ma'am? Yeah. So this is one of our strengths in the in the Philippines is the multisectoral collaboration among different agencies in the government. Of course, this is headed by the Department of Health as chair. I have with me our Assistant Secretary, Undersecretary Gloria Balboa. Please raise your hands to be acknowledged. Yeah, so she's heading the entire agency for the Philippines. Of course, we have the vice chairman, which is the Department of Health. See the collaboration, we have the health. On the other side, we have the Department of Environment or the Ministry of Environment and Natural Resources. And she's here also. We have Assistant Secretary Jackie Kaankan. Kindly raised to be acknowledged. I think she's just around. So see, even in international setting, we have the collaboration here. We have the DNR, we have the Ministry of Health, and we have also the Ministry of Environment. So then we have other 10 agencies in collaboration when it comes to air pollution and health. We have the agriculture, we have the trade and industry, we have the public works, we have the transportation, which is the most needed ministry in air quality and health. We have the interior and local government. We have the science and technology. We have the economic development. We have the information. We have the Philippine Information Authority, which is also one of the important factors in the awareness strategy or initiatives. So these are, I've mentioned the different agencies. And this Interagency Committee on Environment worked on a policy document called the National Environmental Health Action Plan. We have the latest edition, which is the 2030. So this plan, as the name itself, plan, it has programs, list of programs. It has list of initiatives, of interventions, of activities in dealing with air pollution and air quality and health. But the action plan has other sectors like the water, sanitation and hygiene, the chemical, the occupational health, the solid waste management, and other environmental health factors. But highlighted there also is the air quality and health sector. So this is how our government work when it comes to the national policy direction and operational tool of the air quality and health in the Philippines.
Thank you very much. I think interesting to see that we have different approaches where health takes a lead and where in other instances the head of a government, of a local government takes a lead. So thank you. And maybe next time we can invite the Ministry of Education also, because they start to protect your children.
Yeah, thank you.
Let's go now to Mozambique. So please tell us about what is happening in Mozambique. What's the successful story there?
Okay. Hi, everybody. Regarding Mozambique, I think our government is is working hard in order to protect the children. The Mozambican government installed air quality stations around the city in order to monitor the quality of the air, and and they use those results of quality of air, the quality of the quality of air of the city, and in order to inform the community how they can behave, how can they protect themselves. For example, when they go to hospital, the government will put there the infography regarding the result of air quality of the city. So many of the pregnant women, including children, they can understand the importance of air quality and how it is important. This is one of the initiatives that the government implemented around the city. The second one is going to be implemented this year, which means regarding the monitoring of the air quality in the health in the household around the country. So the idea is, in Mozambique we have a lot of mining companies, and the level of air quality look like it's going to be a little bit is not going to be the good one. So the government is very worried because of that, and they are going to make an assessment on the critical areas in order to inform the population about the level of quality of this of the air, and how the population have to behave around that. So I think that is some of them that are very critical and important for the population, including the children.
Thank you. Thank you very much for this insightful point. So now I'm moving to Rosamund Ella Kissi-Debra from the Ella Roberta Foundation. So please, from your foundation, what are you doing? How are you moving things?
Definitely what came out of Ella's inquest was expanding the ULAs, which is a clean air zone. So we now have the biggest clean air zone in the world. And the results of a year long show nitrogen dioxide going down. So the plan is to roll that out across the country, and that's through engagement with mayors from different cities. And I think also, in a way, what gives me leverage is the coroner's report. And I mentioned this morning a number of recommendations. So also working with everyone in health to get educated on that. And we're going to have new asthma guidelines out, which doctors have been working on them for quite a long while with the likes of Jonathan. And so now it's about implementing them. It's not, there isn't just one thing. There are various things you've got to do. I met with the health minister as well, and what I'm really pushing for is a public health campaign led by the chief medical officer to educate the population about air pollution and health. So I see this as a multi-approach across all sections. You need health professionals, you need mayors, you need the government. And the government in the UK, we have a situation where our they're going to have a new health mission coming out, and the health minister is interested in a preventative approach. So cleaning up the air, that would be one. Is to stop people from getting ill in the first place. And so not just him, so it's including health, the environment, transport, and we've even realized housing and education. Everybody needs to work together. The solutions are incredibly challenging, but the amount of money we spend every year on health, we spend trillions, all countries, and I think governments everywhere, they need to decide what is most important to them. They talk about the economy, but I always say if people are ill, people can't work, then they are not gaining from that. So that is my message, when you're dealing at the highest level. And also for them not to be scared, because they're always worried about backlashes, aren't they? That is something that is every city I sort of listen to, they are worried because they have to make very difficult decisions. But I think I will say that again and again, and I told the health minister, you need to tell people why you are doing what you're doing. If you don't tell them, then how can people support it? You can't just impose these things on people, you know, because people see it as making their lives more and more difficult for them, maybe about walking, cycling, things like that. So why don't you tell people why you're doing that? I think the populations need to be educated, and the coroner was very, very clear. Raising awareness is key. Generally, if you have asthma or so, then you tend to know about things, but the general population at large, we sit here and everyone knows about these things, but that's not the same out there. So I think public health campaigns should go through all countries, not just the UK.
Thank you so much for your inspiring words. So my next question, you're all here because you have success stories to tell, because you did good things where you are. So I'm going to ask you, what's the secret to your success? What can you tell others? Sorry, that's a question they didn't know about. What can you tell, and that's why I speak a little bit more. What can you tell others? What will inspire others to do what you have done?
One of the things that I think that is critical for us is that something that is called like the government triangle with 3 angles. And something that is actually happening in the case of the country, that sometimes people think that they have a political project and that is enough. And you have a political project, and you have policies, and then you have plans, and you have programs. And sometimes people think that documents, laws change the world, but they don't change the world by themselves. You also need the other 2 angles that are capacities and also governance. And that's the case of what we are observing right now, in my opinion, in the case of the changes in the healthcare system at a national level, is that, of course, you need a political project. In the case of air pollution, we have a lot of regulation. Maybe they can be better. Maybe we can improve our standards. But that is nothing without capacities. So something that, for instance, in the case of Colombia, we have, in the case of Bogotá, we have IBOCA, el Índice Bogotano de Calidad del Aire, and something in which we are working is to give this tool to people as a tool of accountability, even if we know that they are going to use this against us and for political control. But that is democracy, is to give the people the tools to debate with you and to control your actions and your policies as much as they do, for instance, in water or for. So, and we need to develop capacities, and for instance, to involve parents' organizations. Parents' organization in the case of Colombia have been very active, for instance, in labeling, food labeling policies and other health policies. So, but they don't have the information, not too much, to make this control. And in the other angle, you have governance, and how you can make that other people involved. That is really politics, and that's something that is difficult in the real world. And you don't need just regulation, you don't need documents, as I said, you don't need to combine people. And sometimes it's one-to-one. Sometimes how you can find a common interest that is not maybe your main concern. And that is one of the, just to finish, the main challenge is how you are able to move at different interests in conflict and try to put just a little bit the common interests at the center.
Wonderful. Thank you. Thank you very much. I think this inspires many people. It's very powerful. So back to the Philippines.
Okay. I think for the Philippines, we have this win-win solution. So for example, between the regulators and the private sector. For an example, way back when we were crafting the PM 2.5 policy, just to meet the WHO guidelines, so we started an interim basis of 35 microgram. So the industries are complaining like, oh, it's hard to attain the 35 because our technology is just like this, like this. So here comes the regulator that we insist that we should meet this target at this certain point in time. So there's a win-win solution for that. So we set an interim target. So between the regulators and for example, the top one priority, the top one emission polluters from our countries, for example, the transport section. Then we have the stationary, like the factories, the industries. So we have to set a solution that both of them are winners. So we have these interim guidelines, like for the past 10 years, from 2022 to 2024, I think the Philippines has already reduced like 30% of the PM 2.5. So that's a solution that both the private sector and the government are working together.
Thank you. Thank you very much for putting win-win at the center here. So now we're going back to Mozambique. Please tell us your secret.
I think that the secret in Mozambique is a good collaboration between institutions. The Minister of Transportation is responsible for maintaining the air quality stations. However, the data is available for all of us. So it means that they can generate the data and they make it available for the institution. We use the data and inform the population. So this kind of collaboration is our secret for success. Another part, like the government is supporting a lot. For example, I have the information, credible information saying that, of course, we have partners that support the development of this initiative, but the government is there, the regulation, everything, including financial support, in order to make sure that all information regarding the air quality is available for population, including for children. So when the government is there and is supporting every initiative in the country, it facilitates the process, is a key of the process.
Thank you. Thank you very much for this. So from the Ella Roberta Foundation, we have already seen some of your secrets, but please tell us a little bit more.
It's really interesting. Everyone calls it success. I do not wake up sort of feeling that way, which is really interesting. I guess you would say to me, I guess success would be when I see legislation involved. When someone says to me, "How long are you going to do this?" If I wake up and I don't see any data of children dying in my country, that would be success. But I guess success is those little, so basically even in London we're about to have filtration, ventilation inside schools, and the wins are so difficult, so no matter how small they are, you have to celebrate them. I guess when I first started, like you come out of court, you've got this whole thing, you just think everything's going to fall into your lap, but it doesn't kind of sort of work that way. And I think the more you convince everyday people that this is a problem, the more, when I started, like when my daughter was ill 15 years ago, the amount of doctors those days who were talking about air pollution compared to now, it's a whole sea change. I mean, this morning was very powerful. Was it 47 million? So I would like to think that some of that is a contribution from what we've done in London. And the fact that we're trying to get it into a curriculum so that medics, new medical students, when they now train, air pollution and asthma will become part of that. I guess you will consider it a success. But I think one thing you have to learn is to be sometimes incredibly patient. Things don't happen overnight. I have learned that. But things are definitely different from 15 years ago. We have made progress. And I think when you wake up, you still need to have hope for, you know, for a better future for everyone. So I guess that's what you, but I think a lot needs to change in legislation everywhere, not just in the UK. I think the world over. So we need environmental lawyers, I would say. That's how I see a success, holding more governments accountable for what they're doing.
Thank you. Thank you so much. I think we hear some very different and very complementary things. So small, let's celebrate each step. Each step is an important one. No collaboration at all levels between different government levels with the population, including with industry when it's possible. Win-win, trying to find the win-win opportunities. Communication, even give power to the people by giving them the information about what's happening to them, so there can be a dialogue. And this, I think, was a very interesting to hear, you know, how you are, you know, moving this forward. So I would like to ask if there are one or two questions from the room. I see already 2 hands. I think we can take maximum 3. So we have a question here in the back. If we can have a microphone, then we have a second one. If there's a third volunteer already, let me know. Put yourself in the line. So please identify yourself. So, okay. So, you're after, yeah.
Thank you, Jerry.
Yeah.
My name's Dan Hunt. I'm here with the NCD Alliance. My question is for Maria, and congratulations on the development of your environmental health plan. And I don't think I've seen such a kind of comprehensive multisectoral plan in a long time in a meeting like this. Could you offer any reflections on establishing that plan? Were other ministries keen to support health? Did you have to convince them or even sort of mandate them to participate? And as the kind of the fruits of the labour come, do they champion the outputs for health, or do they kind of sort of begrudgingly acknowledge it? Thank you.
Thank you for that question. So first, of course, we have to craft an executive order signed by the Philippine president. So this is an executive order establishing the Interagency Committee on Environmental Health. Then that executive committee mentioned all the government agencies that have mandate on environment and health. So after that, we came up with an implementing guidelines on how we could implement that one-page executive order, very abstract. Then the implementing guidelines came in 10 pages, like how frequent you will do the meeting, what is the role of each agency, then what are the technical working groups for different sectors of the environment and health, then what are the activities, etc. So once we have these implementing guidelines, the Interagency Committee on Environmental Health could not operate without a plan. So we came up with a National Environmental Health Action Plan in many versions already. Since the WHO introduced it in 2004, the Philippines was able to craft 2005 first edition of the NEHAP. We called it NEHAP. So I think every countries in Asia Pacific region has this NEHAP. So if we could ask from the room, what's this NEHAP? Because it's one of the deliverables of the WHO. If you are a member of the Asia Pacific Regional Forum on Health and Environment, your country must have this NEHAP. So the NEHAP, for example, there's a section there on air quality and health sector. There's top 3 specific issues that you have to tackle for that certain time frame. For example, for us, we developed the latest one from 2022, the 2024 to 2030. So the Committee on Air Quality and Health identified at least 3 top issues that we have to deal with until 2030. So that's how the NEHAP operates. So that's like our Bible or a blueprint or a document that the sector on air quality and health has to look every now and then. Okay.
Thank you.
Thank you.
Thank you. Very impressive. Thank you. Go ahead, please.
Simon Burkett, Clean Air in London. I was also the air pollution stakeholder on the high-level group for UNEP's GEO6. I think the key thing to get change is to make the political costs of inaction greater than the political costs of taking action. And what we've seen in London is Rosamond is very modest, but she has played a key part in making the political costs of inaction greater than those of action. And air pollution has been the top issue in the last 2 mayoral elections. And this is not about politics, this is about action on air pollution. Thank you very much.
Thank you very much for this wonderful addition and showing the modesty of what we have seen here. Thank you. Any other questions for the panel? Don't be shy. If not, I'm going to ask you for last message. What is your message? Here we are with a room full of people who are already convinced. They're already convinced. They are here because they know that air pollution is killing. They know that particularly children are being affected. But what is your message to them? Yeah.
Okay. Maybe my message is that today these topics are like related more with some part of the political spectrum, but I think that it's important to involve the entire political spectrum and say that it's not something that should be led by some parties and not others. And in order to do that, maybe it's a pragmatic perspective, is that imperfect agreement in the real world, I think that is much better than a perfect disagreement. And these kind of topics that are very related with the economic model require this kind of imperfect agreements that maybe are not enough, but can mitigate the impacts at the short term.
I think my idea is that, we should be involved more on this issue related to air quality, because if you do nothing, or if we do not do more than what we are doing now, maybe we can have more negative impact in the future. So in order to avoid that, we should continue doing what we are doing, and if possible, to increase our effort in order to save lives. That is my point. Thank you.
It might be controversial, but I see this air pollution as a health issue rather than an environmental issue. Some people may be in the room, they may disagree with that. But I think health is something that everybody, COVID taught us quite a lot, that everyone really cares about their health. And I think the general population, well, from where I am, in the UK, in the Western world, and the politics of, we seem to be moving more towards the right, and these things seem to be calling. So I think I'm going to stick with that. Air pollution needs to be a health issue and discussed as so, to get, parents care about their children's health. You've got doctors, and doctors can advocate for their patients more. I think that's what I have found. It is easier to talk about air pollution from a health point of view rather than, and actually, when I looked at how the coroner summoned up my late daughter's case, if he thought it was just an environmental issue, he wouldn't have written to the health secretary or the transport secretary. And I think to continue to work with governments everywhere, and I think you're quite right with that. When it comes to air pollution, everybody should be on board. This is not a dividing matter. So I agree with you 100% on that. But it's just trying to get the politicians to see it that way. And I think we should go from here talking about air pollution in terms of health. If you've noticed, well, I can't say I've understood all the things, but health really seems to be the common a denominator amongst all of us. You've got doctors here, you've got scientists here, you've got researchers here, and everyone's talking about health. And that's what I think we need to do going forward. And it's not such a divisive issue then. This is something we can all agree on. We can agree on the deaths, we can agree on the harm it's causing, and we just need to get our politicians on board.
Okay, for me, I think we should, from my perspective, I think we should go to the drawing board, like go to basics, the air pollution 101, like increasing awareness, advocating to every stakeholder, to all sectors in the government, everyone, that air pollution really is killing. So back to basic. So then identifying, mapping out what are really the sources of pollution in your locality, from the mobile sources and from the stationary sources. Then after you have mapped out all this kind of pollution, we should identify all these stakeholders, then getting together, joining together, tackling all those issues raised from all walks of life, from all types of stakeholders, from different sources, mobile or stationary, then we will get together to our endpoint. Thank you very much.
Thank you so very much. And I really think this was a very, very interesting panel. And so some last thoughts about, what you were mentioning about the political cost or action or inaction, and the points that are being made about that this and that health, and particularly children's health, could and should be the argument to move the needle, to show that we need to do things differently, that can even bridge political divide, and that does require to have a very open discussion back to the basics in a way to really show that this is not acceptable and this model needs to change. So again, thank you so very much. A great applause for this panel. Thank you. Wonderful. And so now I'm going to ask you, if you want, you can stay, or if you want, you can go down, whatever you prefer. Yeah. So I'm going to ask now my dear colleague from UNICEF, Anna Azarieva Valente, who is the UNICEF Deputy Representative for Colombia. UNICEF, our partner agency, who has made this possible together with WHO. Please, your final comments. Thank you.
Thank you. Good evening, buenas noches, todo el mundo. I have the best task really to thank all of you in the next 5 minutes for prioritizing being here and focusing on this critical topic for children. I also want to really thank the panelists, the speakers in the policy segment, policy science segment, as well as our keynote speaker, Maria, for sharing this really very rich reflections. My second task is in about 3 minutes now to just leave us here with some key messages for the evening. So in brief, from what we've heard today, the science is very clear. Air pollution is now #1 environmental risk for children and is a critical health issue, as we just heard from Rosemond. Almost 2,000 children under the 5 years of age die every day because of health impacts related to air pollution. I mean, one just needs to pause and understand this data. The second part, very critical, and I think the first panel mentioned this as well as Maria, inequalities linked to the impact of air pollution, impact on health of children are really striking. So when we look at the distribution, if you caught Maria's first slide, we see that the air pollution-linked death rates among children under 5 are 100 times higher in southern, east, west, and yes, across Africa actually, than in the high-income countries. So inequalities are a key story to this. We also heard from our speakers that we're increasingly starting to know what needs to be done and formulating these actions more clearly. So recently, for example, UNICEF and UNEP released a policy brief called Clean Air for Healthy Children, and that looks at the 7 most critical aspects of air pollution for children: household air pollution, secondhand smoke, waste burning, industrial air pollution, dust, sandstorm, and wildfires. Why is this important? Because in pieces of information like that, we start to gather recommendation not only for policymakers but also for caregivers. And I really appreciated from our panelists that key message that this is an issue for everybody. And we haven't spoken much about the role of caregivers, and I do want to mention this here. There was a question from the audience: where is the state-of-art data on the impacts, health impacts for children? So UNICEF and WHO are actually going to release a joint report soon doing this stock take in terms of the health impacts of air pollution on children. So while I can't give you the report just yet, as a moment of suspense, the key message of it, I can give it to you now, which is the time to act is now. The challenges are really critical, and UNICEF and partners are focusing now on this challenge. So what can be done, and this will be the last thing I want to share with you. No matter where we are in different parts of our work, we all have a role to play, right? On policy, but also on immediate action. So what are we doing? What can we do? First, we need to work on improving the capacity of the primary healthcare sector to prevent, treat, to prevent and treat the air pollution-related illnesses. Secondly, we need to focus on the quality of environment in maternal wards and also in the hospitals. Secondly, we are engaging with communities, and we've mentioned already schools, but also early childhood development centers, to actually empower teachers and the caregivers to implement already where they are improvements in their environments for children, and work with caregivers on the preventative risk management actions that they can take in every day already now. And finally, as we have spoken here extensively, we need to continue strengthening actions to commit to air quality and child health. And that involves regulations, enforcement measures, but also adapting cleaner technologies, improving the private sector. So to finish off, every child has the right to live in a healthy and a clean environment. So let us support that right. Let us make it happen. Thank you very much, and enjoy your evening.
Everybody's still here? Yeah.